Nagaland Health Department says doctors cannot be penalized over the Peren issue. The State Health Secretary Keronyu Yhome said we cannot keep taking actions on any mistakes occurred without any malified intentions. Earlier, residents of the Peren district were irked at the state government for releasing a person from Dimapur quarantine center before cross-checking the COVID-19 result, which came out as positive later. The residents demanded actions against the erring officers. In defense of the doctor, Yhome said doctors cannot be penalized under any circumstances, especially in these cases. The healthcare workers should be given all the protections at this stage as the error was unintentional without any malified aim, says. Nagaland Health Secretary Keronyu Yhome has stepped in defense of doctors and said doctors cannot be penalized under any circumstances, especially in this case. Speaking to media person at Kohima on Wednesday, 10 June, Yhome said, "If any action is to be taken as the secretary, I will take the responsibility. The doctors should not be penalized under any circumstances, especially in this case," he added.
This particular incident, I believe, was a case of a very pure unintentional mistake without any modified intention. We have definitely made it very clear that in future such mistakes should not occur again. But as the secretary of the department, I take full responsibility and accountability. Healthcare workers should be given all the protection at this stage. We cannot have a situation where we keep taking action on any mistakes which has been occurred with pure heart and without any modified intention.
Residents of Peren district are angry at the government for releasing a person from the Dimapur quarantine center before declaring his COVID-19 result, which came positive. Earlier, 16 inbound passengers along with a person who tested positive for COVID-19 were released from Dimapur quarantine center on June 3rd and had reached Jaluki under Peren district. The incident is a violation of the new standard operating procedure issued by the state government. It says that persons who returned from Chennai and are still in Kohima and Dimapur quarantine centers will continue to remain until the COVID-19 test is complete. According to health officials, the error was made because of confusion over the similarity in names.
When they collapse, what will happen? The whole state will collapse. Because they are the people who are shouldering the responsibility of all the districts. So, before reaching such a stage, we want to ensure that there is a system where we start distributing the workload and the responsibility. Once the districts get overwhelmed, every district has a facility, but they may not have the facility as in Keronyu. So once they are overwhelmed, then the issue of forcefully sending other people, that question doesn't arise.
Yhome said that the mistakes was unintentional without any malified intention, saying that to err is human. He added that it was made very clear that such mistakes should not happen again. While speaking on the progress of the constructions of Biosafety Level 2 laboratory at the Christian Institute of Health Sciences and Research in Dimapur, he said, it may take another 2 more days to complete and about 90% work have been completed. As per the feedback from the director of the CIHSR, Yhome said the sending approvals to the Indian Council of Medical Research for BSL-2 in Dimapur might be able to commence from June 13 to 14. He iterated that the ICMR approval is not in their hand.
The target that we have set to complete the laboratory was around 10 of this month. The feedback that we are getting from Dimapur BSL, the director himself, they are saying the completion may take 1 or 2 more days because some pending issues are there. We may be able to start the testing, the sending approvals for ICMR processors. I think all those processes may be able to commence only around 13 to 14. So normally, as you are aware, the ICMR approval and all those processes is actually not in our hands.
Briefing COVID-19 status in the state, the principal director said the testing capacity of the BSL-3 lab in Kohima has increased steadily, while Yhome also informed that civil works have started on the BSL-2 in Twingsang.
Civil works on BSL-2 have started, but the actual materials for the lab itself, that will reach maybe a little later. But we are also constituting a committee who will be solely looking for the setting of the BSL-2 in Twingsang. There are 4 districts where TrueNet is installed and up and running. We have 3 districts which will start operation in the next 2 days or so. By June end, we are looking at a capacity of 800 to 1,000 per day, including all the TrueNets and the BSL.
Close to the heels of the ultimatum being served to the Minister for Health and Family Welfare by various civil societies from Twingsang, a TrueNet machines arrived the district on Wednesday and 2 more are set to arrive soon, it informed. He also said that they would constitute a committee that will solely look after the setting up of the BSL-2 in Twingsang. With Inzan Bemukubung, Kohima. We are now joined by our correspondent Inzan Bemukubung from Kohima. Hello, Inzan.
Hello. Yeah.
Hello, yes. So, Inzan, tell me, as claimed by the Nagaland Principal Director of Health and Family Welfare that within this month, all the district of Nagaland will have this testing facility. So, what is the work progress of the biosafety level 2 in Twingsang and Dimapur district?
Yeah, see, the BSL-2 lab in Twingsang district, the engineer and firm have already visited on June 1st. But the actual material for the laboratory is yet to arrive in a little later. So the department would constitute a committee to solely look after the setting up of the BSL-2 in Twingsang. So once the committee is set up, the government approves, they will be taking up the whole matter immediately.